everyone! I'm Mika Padilla, caregiver of Sasan Lipa, Batch 213. Today, I will demonstrate the Nasopharyngeal Sunctioning. The purpose for this is to seek out secretions. Before performing Nasopharyngeal Sunctioning, make sure the patient has no contraindication to the procedure, such as bleeding disorder. And then next, perform hand hygiene. Ensure client's privacy. Then, introduce yourself to the patient. Identify her using identifier. Hi ma'am, I'm your caregiver for today. May I know your name ma'am and birthday please? Thank you ma'am.
Help the patient into a semi-fowler's or sitting position. And then put towel over the chest. Prepare the suction tubing by opening it and connect it to the suction machine. Turn the suction device on, set the pressure into the lowest level possible that will effectively clear the secretions. After checking the pressure by blocking the end of the tubing, place the open-ended tube near the patient with an easy range of your work area. Fill the basin with about 100 ml of sterile normal saline solution. Place the drape across the patient's chest or on the overbed table. Then open the water-soluble lubricant and squeeze it. Be careful not to touch the package depending on your agency's policies. You'll now apply a pair of sterile gloves in your dominant hand and a clean gloves to your non-dominant hand. Use your dominant hand to pick up the suctioning catheter without touching any surface. Using a dominant hand to pick up the connecting tubing and attach the catheter to the tubing to make sure that the equipment works properly. Suction a small amount of normal saline solution from the basin. Coat 6 to 8 cm or 2.4 inch to 3.2 inches of the distal end of the catheter with the water-soluble lubricant. Okay, I'm gonna go suction down your nose into your lungs to help get out secretion. Use your dominant thumb and forefingers to insert the catheter gently but quickly as she inhales. The general rule is to insert the catheter through roughly the same depth as the distance from the mouth or tip of the nose to the angle of the mandible. Apply continued suction by placing your dominant thumb over the bend of the catheter for 15 seconds or less. At the same time, slowly withdraw the catheter as you roll it back and forth between your dominant thumb. Rinse the catheter and connecting tubing by suctioning normal saline solution until the catheter and tubing have been cleared. Detach the catheter from the connecting tubing loop, the catheter around the fingers of your dominant hand. Pull your gloves off inside out around the coil catheter to isolate any contaminants. Remove your other gloves and turn off the suction device. Dispose of all the supplies in appropriate receptacle. Remove and dispose of the drape and reposition the patient. Perform hand hygiene. Document the procedure, including your pre- and post-suctioning assessment, the amount, consistency, and the color, odor of the patient's secretion, and the size of catheter you use to the patient respond to the care.